Hi, everyone. Thank you so much, Rashmi and Scleroderma India, to help me speak and, get them understanding how movement really helps. So, thank you, Dr. Neha. I just heard you talk. I think it was beautiful how she has, said about nutrition, which is from inside with food. I'll be talking about nutrition from outside, and that's exercise and movement. I've been dealing with a lot of patients who've had autoimmune issues and also scleroderma. So, mainly, I'll be talking about, let's start with talking about scleroderma, which everybody knows because of the extra collagen that has been produced. But I'll be talking about major three core systems, which where exercise can really help and can improve, in general, the quality of life of the patients. So, let's talk about first is the musculoskeletal system, the major system where you're moving about. Um, the first one is we had a lot of patients coming with myositis. So, where we see a lot of muscle pain and a lot of stiffness of muscles in general. We have a lot of patients who come in with lesser joint mobility. So, in general, when we see them, the movement is such an issue. So, I know that I've spoken about this before also about how movement can help, but today I'm going to be talking about mainly uh, I think questions that people come up with and ask me that how do I manage this? So when you have a myositis attack, when you say that there is a time where you have a lot of issues, what do you do? Do you rest? Do you exercise? Do you go ahead? That is the biggest question that I see people really keep having. So my question, my answer would be more that you don't just rest, or you don't just keep moving. The extra effort that you take might create more inflammation. What you do generally is you tend to rest out at some point when the inflammation is really high with the medications that you can help you, your anti-inflammatories, everything. But you do not stop moving, because movement is so important that it can um if because at that point, if you stop moving, it can definitely indulge in reducing that movement altogether. Because I've seen patients with scleroderma from moving about, if they have a deformity, if they have the myositis attack, or the back pain, the leg pain, the movement, as and when you start reducing the movement, it actually just reduces. And finally, you're not able to get off the bed also, which in fact also affects a lot of other systems. So I'll be coming back to the movement, but we'll be talking right now about the musculoskeletal system. Then we'll be talking about joint contractures that we have.
Ugh.
We have deformities. Excuse me, I heard somebody talking. Is it
No,
okay?
no. Go ahead, please.
Go ahead, right? Yeah. Okay. We talk about joint contractures. The joint contractures that happen with the foot, with the hand, a lot of times the mouth. So when it happens with the mouth, the blood, the circulation is an issue, because the breathing might become an issue, the gut might become an issue. We're not able to open your mouth fully. So that is one thing that really happens. The joint contractures, especially when you have deformities with the hand, you're not able to move because you're not able to hold. So all these things actually combine and help you. They create a lot of obstacles in moving about. Then let's get to pulmonary system. We all know that it causes fibrosis in the lung, right? And all there's a lot of weakness of the respiratory muscles themselves because of the myositis, because of sometimes the stiffness. So, anyways, the fibrosis is causing a lot of lesser muscle efficiency, but the weakness of the respiratory muscle also does reduce, right? We talk about hormones, very very important, especially when we know that scleroderma, the women get affected more than men. So the estrogen also goes, there's a lot of hormonal imbalance because of a lot of other systems also being affected, but hormonal system in general directly gets affected. So we need to take care of those things also. So and the last one, it's the gut health, right? The digestive system. um we have the digestive system being affected. um as she said that, the digestion starts in the mouth. Now when you're not able to open the entire mouth, what happens is you're not able to chew, you're not able to really digest, you're not able to, in general there is an issue here, right? So and with combination of all these systems, your neurological system, being a neurophysiotherapist, I will never let the neurological system talk about that, how it really gets affected. The neurological system, there are two kinds. There's one is your mental health, one is your neurological actual physical health. It doesn't directly get affected, but it does. I will be answering these questions. I've got some questions. Keep asking me questions. I will be answering them definitely. Okay. After I finish the entire thing. Okay. So, the neurological system, the physical health, when you stop moving, the neurons in your body also start dying. Okay, they are, I mean, not in the sense, it's definitely slows down the whole process. You are not able to move, so mentally also you're not able to really get there and move. So these are your entire 4 5 systems that physiotherapy can really, really help. Now, how do we help, right? I'm not going to be talking about exercise. Please do this, the exercise, the kind of exercise. Today, we're going to be talking about how much to do, what to do, what do you should be expecting out of physiotherapy, okay, till when you should be doing it, and what really you should be expecting out of the exercise, and how do you know you're doing the right kind of exercise with the right person. Okay. Now, autoimmune issues come with, especially scleroderma, with a lot of complications, symptoms. So, do you really go symptomatically? Do you treat them symptomatically, or you are actually addressing the system and actually addressing the disease itself? I would say both ways. Sometimes when you have the myositis attack, sometimes your gut is not okay. So let's, go out there and individually treat the symptoms so that that makes you feel good. And eventually you look at the person on a whole. I keep talking patients, but I would love that, you look at the patient or the person on a whole. You do not look at them with scleroderma. You or tell them that you have one, two, three, four issues. No, you should look up to them like, what does he or she want to do? Why do they want to move? What is their daily activity like? What is their age? What kind of activities and functional goals do they have for their themselves? And the main thing is motivation. So important. Now, what are the kind of exercises that a patient with scleroderma can do, right? Now, we will divide the exercises into 3 to 4 kinds. The first one is cardio based. Actually, I think Dr. Neha said that you need to do a lot of cardio activity, which is good for you. If today you are able to walk for 20 minutes, go on for the 20 minutes for the next 10 days. You don't need to increase it, decrease it, nothing. Just go on for the 20 minutes with good intensity work. I get a lot of questions that, doctor, मैं कभी तक exercise करूं? And I just tell them, till you're breathing and till you're living, please exercise. If you're eating your medications, you have to exercise. The day you stop taking your medications, stop exercising. It goes completely hand in hand. Okay. So that is one kind of the cardio exercises. You can choose swimming, you can choose just a normal stationary bike, you can choose walking, you can choose brisk walking. Whatever you've been doing till now, do not stop. Stopping is, there is no scleroderma doctor or anybody says rest. There is no rest. You can rest if you feel fatigue. You can just take that break for a couple of days, get back to working, get back to movement. I always say movement heals, and the correct kind of movement will heal you better. So that is one kind of exercise, the cardio exercise. The second one is going to be your strengthening exercises. You can pick up light weights. Heavy exercises at the current stage, I wouldn't really suggest. So pick up light weights, your 1 kg, half kg. Have your form really correct. That is very important. You cannot get injured at this point. Already there is a lot of inflammation in your body. So make sure that you're not getting injured. Take up a nice trainer, ask them the form, take up their advice on what exercises can I do with the condition that I have. The main part is going to be maintaining what you have, at least for now. And then getting better is going to take time, but at least maintaining the integrity of the joints, muscles, and maintaining what you have. Even staying plateau is going to be progress for such conditions. So, yes, you're going to be doing that. Strengthening exercises, like you can take up Pilates. Pilates is a great form of exercise. We really do with a lot of patients, clients, everybody that comes into the studio. And it's proven to be so amazing. Now, how is Pilates different from another exercises? We focus a lot on core training. So when you focus a lot on core training is just not your abs muscles, it's also spinal muscles, it's your deeper scapular muscles, it's your deeper leg muscles, everything, the smaller muscles basically. So helps you be a little leaner, it helps you generate, it makes you less fatigue, and also creates a lot of energy and the feel good factor. Of course, the strengthening is a great part of it. How many times would you do that? If you're doing already walking around, doing something related to cardio, I think twice a week Pilates is great for you. If you're picking up some weights, give yourself that break. Do not continuously do either Pilates or the gym or some weights. Give yourself that break at least twice in the week if you're doing exercises every day, walking around and everything. And the best way to get that steps is not going out there and doing, 6, 7 kilometers. It's about, if you are taking the staircase, if you have stairs in your building, go take the staircase. If you have to go and buy something instead of Zepto, Swiggy, Zomato, let's go out there, go out your building, walk there and come back. So create that movement and active lifestyle that's going to really help you to maintain the movement and also the blood circulation that it really requires. We'll talk about breathing now, right? Now with strengthening, why am I catching breathing? Because the fibrosis might not be in your hands. So the lung capacity, how else can you maintain it? You can maintain it by really, really strengthening your respiratory muscles with deep breathing exercises, TheraBand breathing exercises, also helping, one lateral breathing exercises. I'll be showing you right now, which I feel the diaphragmatic breathing is so amazing. You take your hands here, right? And you're going to have your hands here, right? Now, you will not see my shoulder go up and down. You're going to just breathe in through your nose. You see, my chest is actually floating, they're bloating up like a balloon. And that's exactly what I want. This is not this. Okay. It's just, and then you're going to just reduce. That's exactly what you're going to do. It's excellent. How can you strengthen it? If this you can do like 10 to 15 times, take a TheraBand, which is stretchable. Move around this. Okay. And take it tight and then strengthen it. You're actually resisting it and you're strengthening your respiratory muscles. It's a great way, so simple, just a very simple way to strengthen your respiratory muscles. It is the start and the most energizing thing. You can start your day with this. Have do some meditation. Start your day with something which is, with breathing, and you can start exercising too. Now let's go to yoga. Um, I Pilates is something that I'm really trained in, so we do a lot. But yoga is a great form of exercise in general. Getting into that, for a mind and soul, getting into that position. I think the stretching, the flexibility, all of these things really. But do not overdo. I'm talking about Pilates. I'm talking about cardio. I'm talking about all these things. I am not telling you all to do this on the same day. Please do not do it. Do not make exercising or anything related to your condition the center of your life. You have a life, you have to lead it. Please live a very normal life. And it's very, very important. Do your daily chores, do your daily activities. And also the family, I please tell them that they're not sick. They just have a condition we need to deal with on day-to-day basis. So please let them do their own work. Please do not help them in, helping them to do their work. Please don't do that. In fact, encourage if they're doing their own work. Okay, you have to do your own work. You have to find a way. The body and find a way. Instead of the curling of the fingers, they'll find a way to help it to do with the palm. It's fine. By actually doing work for them, you're not helping them, you're making them helpless, and that's really not okay. So let's not, let's encourage movement and let's help them to do their work on their own and also lead their normal lives, right? So yeah, so we're talking about breathing. And I'm going to get to aqua therapy or swimming. Um, Aqua therapy is one of the most amazing exercise for patients with joint mobility immobility. So we have patients who have autoimmune issues. Of course, please check on the hygiene. If it is a water heated pool, it's really good because it really soothes your muscles. Something very very cold is not good. We have Reynolds that can cause a lot of issues there. So help them have a heated pool, hygiene pool, of course. And you can do some exercises once or twice in the week, just for a change, so that it doesn't stress your joints. Water exercises in it will help you develop more flexibility without really the pain or anything. And also the mobility will be maintained. Of course, the calorie burn is also much more than in land, right? We'll be talking about now about neurological physiotherapy. Now, why is that very important here with scleroderma? What we've seen is when your muscles start getting affected, your breathing, your circulatory system gets affected, your balance and gait training, okay, both of them really get affected. Now, balance, why it gets affected? When you have pain or when you have inflammation or you have a muscle which is reduced in strength or there is atrophy, there is a higher chance of one side or that side where you have atrophy to have an imbalance. Your posture alignment changes. You have a lot of changes in terms of, you know, uh, muscle girth. So the girth of the muscles, reduces. So that causes a lot of imbalance between two muscles and that causes more pain. So yes, the myositis might not be in your hand, but the effects that happens because of myositis is definitely in your hand. So you have to make sure that the posture is correct. Look at yourself in the mirror. See if you're having these issues. If you think that body doesn't look symmetrical, you have to immediately go to the physio. Tell them, please correct this and tell me what I need to do further so that that my postural balance remains great. Balance training, you should be able to do one leg stand for at least 10 to 20 seconds on one leg without really losing your balance. That is your minimum normal person goal. If you're not able to do that, and if you find that there is a it's getting difficult or you have the fear of fall, you should visit your physio and tell them, this is what I need to do. I need to create stability, I need to create strength. Gait training, what is gait training? Is the way you walk. If your balance and strength is not very great, you are going to have effects in gait training. What happens is that when you have deformities in the hand, the shoulder also starts moving a little less. So what is happening is when you're walking, you're doing extra energy expenditure to walk, and that's why you're getting more fatigue. It's not your lungs. Maybe in the start of the condition itself, it's not your lungs, it's not anything else. It's just because you had an inflammatory issue, you have been just, lying down, resting, or something like that. You've not been really focusing on that. That's why you're getting fatigue. It's not just the condition itself, it's also combining all these things, and that's why you're getting fatigue. So make sure that you go to the physio, get yourself sorted, and make sure that you are continuing your exercises. Go to your physio every 15 days. Once they show you the exercises, that exercises might run to you for only probably for just 6 weeks. The body has a very very good a property of getting accommodated. 6 weeks is maximum. That's why you keep changing your exercises. Intensify your exercises. If you're today doing an exercise or if you're doing some bridging, right? If you're holding that bridge for like 5 seconds, eventually you should be able to hold for 10 to 15 seconds or maybe do some variation in bridging. So that is very, very, very important. After 6 weeks, go and visit your physio. You'll have heard people saying that मैं गई थी physio के पास, I got exercises done. I do that every day since last 6 months, but now I'm finding it, I'm not पहले back pain मेरा treat हो गया, but now it's not happening. If you're aging, your condition is probably getting more severe. Even if it's not getting severe, you are aging and your body is getting accommodated to these exercises. You have to visit your trainer or visit your physio every 15 to 20 days minimum if you're not continuing with them, to tell them, tell me the exercise now I need to do. If I'm able to do a certain exercises just with my body weight, I should be using therabands, I should be using weights, I should be using something. It has to intensify, it has to challenge. I always say in an exercise which is 45 minutes, The first 20 to 10 minutes is definitely a warm up or anything. The next 20 minutes has to be something that you're able to really do. It's really fun and you're able to achieve. The next 10 minutes has to be something that is very difficult to achieve. We're still able to do it. The last 5 minutes before the cool down has to be something you're not able to achieve. So you know that that is your goal for your next one. It has to be like that. Just coming and doing pranayam, and I've heard people do go for yoga and just do pranayam and say, okay, that's all I can do because I have this condition. No, there is no excuse to do exercise, to not do exercise, even if you're bedridden. Let's talk about that, which is so common. Even if you're bedridden today, you're not able to move, there is something definitely up for you that you can do for 45 minutes. You can do a lot of lying down exercises. You can do a lot of sitting work. Sitting exercises are so important. You can be on a ball and sit and learn the balance exercises. You always remember that movement can just get you better from one position to the other. It's okay if you're able to just go from lying down to sitting for the next 2 months. At least you're not deteriorating. That's what you need to look forward to. So don't stop your physio saying, "Arey, it's not happening." And, I'm just saying that's also progress because you're not deteriorating. So you have to look into it that way. And you have to make sure that the trainer or the physio is taking you to that next level, is able to push you there and making sure that knows your strengths and able to push you to a better movement work. How many times do you exercise? I think strength training can be good twice to thrice a week. Choose your strength training, what you like. I would suggest stick to some one form of exercise for a while to see how it really, helps your body, and then probably change after 6 to 8 months. And if you like that form of exercise, you think this is a good strengthening exercise like Pilates or yoga or something, stick to that, reduce that, and maybe add like an aqua therapy once a week or something. But having a different form of exercise all the time, what happens is you go to different trainers, they'll not be able to take you to the next level because they're seeing you only once a week, and that becomes very difficult, right? So that is something I would suggest, that stick to one person who's seen you, knows your knows your strengths, knows your weaknesses, knows where to really work on. And that's very important, right? Your entire exercise needs to have combination of breathing, cardio, strength training, has to have balance, gait training, all of these things together. That's going to make an wholesome thing. And definitely functional exercises. Functional exercises for you would not be your burpees, your mountain climbers. No. Functional exercises can simply just be obstacle walking in gait training, or maybe dual tasking, or doing something like just a very basic bridging. We're doing a dual tasking with it. So that is going to be a functional exercises depending on what your level is. If you are a corporate person, we are going to make sure you do not leave your exercises or your work. You can't, just because you got this condition, don't leave your work and come back, because this cannot become the center of your life. People are living with diabetes. Even 20, 30 years back, people thought, oh my god, I have diabetes, I'm just done. Like, now everything is revolving around that. What do I eat? What do I exercise? No, it does not. It does not. You have to live your normal life. And that's very, very important. Spend time with your friends, spend time with your family, and making sure that you move ahead in this journey. And that's very, very important, right? Okay. Anybody has questions for the bedridden part, or how do I move?
Dhwani,
Please
can you
put
take
in.
the questions offline, please? Do you mind answering them in
Sure,
the chat? Because we
sure.
still have two more speakers to go.
Okay, okay, done. Wrap.
Yeah. Thank you
Okay.
so much. Nilesh, please go
Yes,
ahead.
yes.
Okay,
Okay.
so thank you so much, Dr. Dhwani. Actually, we forget that exercise is a hygiene that one need to maintain irrespective of our conditions. And I really liked how you mentioned that we should avoid our ordering online things, and we should take ourselves out and get things done. And family members should also support us in doing things whatever we want to. And thank you so much for introducing us to different types of exercises.
Thank you so
And
much.
it will definitely help us somewhere. And thank you so much for the session.
Thank you so much. Thank you so much, Claire India, Rashmi. It's been great. And you all can call me. I think Rashmi has my contact. And on Instagram, I'm at Miran by Dr. Dhwani is the name. We can definitely connect there if any questions you have regarding exercising and movement. Yeah, thank you so
Thank
much.
you